Vulnerabilities during pregnancy, childbirth, and the postpartum period. Every phase of pregnancy, childbirth, and the period after birth has a significant impact on the lives of women. It is during these transformative moments that comprehensive healthcare and support systems become especially crucial. Taking care of women's health during these transformative moments is important. This line illustrates the degree of overall health of a woman, ranging from optimal health at the top of the spectrum to death at the other extreme. The horizontal axis represents different time periods that women experience, from pregnancy all the way through to the postpartum period. At the beginning of a pregnancy, a woman with optimal health can maintain the same level of health and well-being throughout the pregnancy. This prepares the woman for labor and childbirth when risks of adverse outcomes are often elevated, and enables her to return to her optimal state of health in case of exposure to any risk. During the postpartum period, being in a state of optimal health helps a woman to sustain good health and well-being in the long term. However, some women begin their pregnancy in a less than ideal health state, which makes them vulnerable to emerging threats and barriers as pregnancy advances. This vulnerability trajectory is influenced by the emergence and accumulation of threats and barriers throughout the phases of pregnancy, childbirth, and the postpartum period. Likewise, reparative strategies can counteract the forces of threats and barriers, pulling the woman's vulnerability trajectory towards improved health and well-being. As the pregnancy progresses, threats and barriers push a woman's vulnerability trajectory downwards towards adverse outcomes. Simultaneously, reparative strategies help guide a woman's vulnerability trajectory towards improved health. During labor and childbirth, if the threats and barriers overwhelm the reparative strategies, the woman's health deteriorates, pushing the vulnerability trajectory towards adverse outcomes, including death. Likewise, in the immediate postpartum period, unexpected risks could pose a threat challenge and lead to the woman becoming more susceptible to adverse outcomes. At any point during the continuum of pregnancy, childbirth, and the postpartum period, whenever threats and barriers significantly overwhelm the reparative strategies in place, the vulnerability trajectory is pushed towards severe adverse outcomes, including severe morbidity and death. During pregnancy, threats and barriers could lead to miscarriage, worsening of pre-existing medical conditions, preeclampsia, fetal and maternal death representing the most severe outcomes on the health spectrum, to name a few examples. Around the time of labor and childbirth, examples of adverse outcomes that could arise from overwhelming threats and barriers include difficult labor, postpartum hemorrhage, preeclampsia and eclampsia, maternal sepsis, and maternal death. Threats and barriers during the postpartum period can lead to anxiety, mood disorders, mastitis, maternal sepsis, maternal death, among others. This figure depicts different health scenarios for a woman with optimal health and another with a less than ideal state of health throughout pregnancy, childbirth, the postpartum period, and beyond. Therefore, a woman starting her pregnancy in an optimal state of health presents the desirable trajectory throughout the pregnancy, childbirth, and the postpartum continuum. Whereas, for a woman starting pregnancy in a suboptimal state of health, reparative strategies become crucial to prevent adverse outcomes, including averting death.